na ripoti ya nini kinachoendelea katika sekta hiyo ya afya ambayo tumetaja ni muhimu katika kujaribu kudhibiti maambukizi ya virusi vya corona. Tusikize anasema nini.
Mr. Simon Kimutai, Mr. Kariuki, Bogwa, so that they can also give you their perspective, because this is a partnership. Government cannot do everything alone in terms of making sure that we follow and we comply with what you are saying. We must make sure that everybody plays their part. And so we also have Ministry of Health, because public health is also crucial in making sure we contain this virus. And before I invite the Matatu associations, let me request Minister of Health, who are here to make sure they educate the public, the passengers, for them to say something before I request Dr. Amoth, who is the Director General in the Ministry of Health.
Thank you, Waziri. I will also want to echo the same sentiments expressed by Waziri. The Matatu industry is a key stakeholder in the fight against COVID-19, and we have mapped important and critical stakeholders who we are trying to reach each and every day. We have started with you because of the critical role that you play in ensuring that Nairobians move from one place to the other as we build our economy. We will continue to partner with you and other sectors, including religious organizations, police, the National Police Service, the prison service, and everybody. Eventually, we want to ensure that we send our messages reach the lowest level of the community, and our key message is basically prevention, prevention, prevention. And prevention, we are talking of basic hand washing with soap and water. And if available, you can use the alcohol-based sanitizers. Keep your distance, what we call social distance, at least 1 meter away from your friend or your colleague. Practice respiratory hygiene. When you are coughing, cough into a tissue or your handkerchief or your flexed elbow. And also keep away from anybody who is having acute respiratory infection. Stay at home unless you are going to visit the doctor. And together as Kenyans, we have been able to overcome other challenges before. We shall also triumph over COVID-19. Maybe allow me, Waziri, to give my colleague, the Director of Public Health, to say 1 or 2 words. Dr. Bacho.
Asante, Waziri. So Kenyans, we have come here to show how concerned the government is. Now, I think most of the basic issues imesemekana. Let me now address the actual problems and what is happening with the Matatu and transport facilities. As you are all aware, in this business, we are using vessels or vehicles. And these vehicles are the ones which are carrying our people in this country. Now, going forward, a few things might not need to be done differently. But of course, this is how it was supposed to have been done. But now we need to adhere and work along those lines. One thing that we require is that there will be need for us to ensure that most of our vehicles, all our vehicles, after work, we clean them. Now, you can also use a duster with something like jig to just, the metal parts and all those other places, you just rub it up. But if you have got a spray, which is alcohol-based, you can spray the seats. And for those of us who are actually handling the money, I think you require to have sanitizers because you are handling hard money. Now, and again, protective gear for those of you, especially the Matatu, the drivers and the conductor. Now, for your passengers, we are only calling upon you to walk with us on this journey. It will be very necessary for you to protect yourself and your passenger. Can we use sanitizer? So that, because there might not be water at that given point in time. So sanitizer would be the most ideal thing for you to use. But for the terminals, we want to encourage that where there is running water, the best, cheapest option is washing hands with water, with any ordinary soap. So this requires to be adhered to. We continue to engage ourselves. But again, for purposes of information, we want you to also know that there are a few things that you need to be able to know. As a person, you as an operator or your customers. If a customer has got a problem with cough, hard in breathing, sneezing, I think the best thing is that they should be advised to seek health medical attention in the nearest facility. Why do we say so? All our counties in this country, 47, they are also in this. So please, this needs to be taken. Again, in terms of now case, we might be able to follow those who are actually actual suspects. Again, we need your highest cooperation. Why? Because this person, maybe you would have carried a passenger who is a suspect. So it would be nice for you to give us the information. First, we will want to disinfect your vessel or the vehicle. And then we want to, again, trace the people who would have been in that matatu at that given time. That way, we minimize further risk of the transmission. I think this is what we would want you to take home. And we are only requesting that you be with us in this partnership. And if we work all together, we'll be able to manage. Thank you, Waziri.
Thank you, Dr. Obacho. Sasa mnajua kuna washikadau wengine wako hapa katika hii sekta ya matatu. Ningetaka Mr. Bugwa aseme machache, alafu nipatie Simon Kimutai afunge.
Thank you, Bwana Waziri. From the matatu point of view, a number have complied. You have seen in the media them washing the passengers as they board in the vehicles. But the problem here is the sanitizer has gotten out of stock. You can't get any in the supermarket, in the pharmaceuticals, chemists, you can't get that. We would wanted to insist that the suppliers really up their game in bringing more and more and more. The other thing, of course, during this time when the schools are closed, the colleges and other institutions, the matatu business goes down because at least a quarter or 1/3 of the commuters come from those institutions, that's the schools, colleges, and what have you. And we would want the government, when it sees that, I don't know how you are going to handle this with the banks, commercial banks, so that during this time, they relax the payment of the loans so that at least matatu investors are able to cope up, because as we are talking, some won't be able to, get enough to pay for their repayment, installments in the month.
That's a very good point which has been made by Mr. Bogwa, that financial institutions, they also must play their part.
Yeah.
Because we are trying to save our country together. So if they don't do what is being requested, there will be no customers to serve in the first place. And so we like to request them to, just like other business people, to make sure they play their part in ensuring that in partnership with the matatu operators, to ensure we sustain this business going forward. Let me now ask Simon Kimutai to make his remarks.
Thank you. One thing that I would want to urge, I'd like to urge the media houses to give right information, because we've had lots of information that are misleading. We want the basics to be known by either passengers or even people at home. What is important here is to ensure that nobody spreads the virus. We know very well that we facilitate movements, and in the course there could be a person who can easily push it to other passengers. For us, we are ready to play our role. What we just want to urge the Ministry of Health is that they take over the toilet facilities that have been turned into commercial use by some traders, that there is water available at bus terminals, and I would want to urge the Matatu fraternity to be able to take care of them, because already I'm told there are institutions which have already started putting water dispensers at their terminals. So I want to urge that this should be protected. And also we would want to say that handling of cash, I want to urge conductors to prefer accepting M-Pesa, because there could be a way of transmitting the virus. If one single note can circulate to many people, by the end of the day, it will have infected so many people. So there is flexibility. We know very well that Safaricom does not charge when you transact less than 100 shillings. And if it is even more, it's better to, to lose that little money and save a life. The other issue is availability of sanitizers. We know that people have rushed in and the supermarket shelves are empty. We don't have a place where people would be able to get them. But we would want to ask the suppliers and also the intervention of Ministry of Health to subsidize. If there is any allocation of funds, this is the right place because the convergence. Very many Kenyans use public transport. So if there is a budget, let material be supplied to bus terminals, especially to sanitize. The last one is about, well, let me end there. Sorry.
Yes, in closing, like I said, we are dealing with an integrated transport system. You have seen the commuter rail, which brings about 40,000 of passengers every day. And now there's matatus. So we like to insist, matatu owners, make sure that you have those sanitizers without fail. Make sure, like the doctor said, that we clean our buses, not in the morning and the evening. Each time you come to the city, drop off passengers, make sure you clean those buses. That's what we have also insisted on the trains as well. We have told Kenya Railways to make sure that for each trip, the trains are fumigated and cleaned, because this is a matter we cannot take any chances, especially because it's a matter of life and death. I think we have taken questions earlier, so I'd like to thank you very much for coming. Asante.
Thank you.